Okay, now the Dr. Selena, she is my wife and she know English, so quality explain about our works and about the Ibogaine and about the complex treatment of the heroin and the opiates and some alcohol addiction in the Ukraine, and about our short way, and about our clinic and some rules and some provide Ibogaine in the Ukraine. And after that, I think we have some good discussion. It's why Dana and the other guys know when the Star Wars in the Ukraine, we change our location, and now we are living in the Czech Republic. And the main problem in the 1 o'clock, I must be in the surgery department, and I like a doctor anesthesiologist now. And we speak with Yelena. She are very wonderful and very knowledge person who is now about Ibogaine, maybe little bit low after me and Dana. Hello.
Yeah, sorry. I don't know if you have a presentation, but we cannot see it.
Can I introduce myself? I'm a doctor narcologist. My name is Lena. We worked in Kiev, in Ukraine. We have a medical center, but for now, because of war, the center is closed. What I want to tell today about Ibogaine and its uses in complex treatment of heroin addiction. Situation with drugs in Ukraine for today. Situation with illicit trafficking of narcotic substance, psychoactive and psychotropic substances are more acute in the world. According to various sources, Ukraine takes fourth place in the world destruction and using narcotic substance. I think for this moment, because of war, this place will be higher. It is useful to know that the traffic of narcotic substance from Asia to Europe throughout Ukraine is very huge. Only official statistic from 2020 in Ukraine, more than 500,000 citizens for which are registered of the systemic intravenous using narcotic substance for the opiates group. According to unofficial date, amount is 10 times higher.
We can't see the slideshow.
You cannot see the slide.
Right.
Do you see slide or not?
I see them, but other people are not seeing them.
It's the problem. I cannot know how can I do it.
Go into share screen.
We try to do it, but it cannot work. It's a pity.
Try
share screen.
Share screen. You see the green? The green.
Oh, wait, I got it. I changed the setting.
It works?
Yeah, it works now.
Great. Substitutional therapy in Ukraine. The application of synthetic medical opiates of methadone and buprenorphine legalized, like in European country, have substitutional therapy. It helps to lead a person from street drugs, reduce the risk of infection, decrease in the liver, of criminalization, socialized. But 500,000 officially registered drugs user, the state finances only 8,000 places of software substitutional therapy. And what is the result? There are a lot of recipes clinic where anyone for $10–20 can get a recipe for narcotic analgesics, tranquilizers, and precursors freely get them in a specialized pharmacy, buy drugs legally. Medical treatment. If you professionally approach the consideration of this issue, we can find some private drugs clinic on the territory of Ukraine where a patient can solve the problem of dependency and do not replace from one drug to other drug, but really heal a person. You can cope with addiction and former drugs addiction are a target and motivation is needed, while complex and qualified treatment in a specialized medical center. Many reads, some used and describe the experience of using Ibogaine in their medical practice. Its unexpected psychedelic effects on the human consciousness and deep subconsciousness, on its use in the treatment of people depending on psychoactive substance and alcohol, on the treatment of people with severe depression and long deep phobias. The recording of the mistakes of young and the desire to know the truth, changing yourself. About the healing and psychedelic effects of iboga root extract on the human brain. First, the unique psychedelic effects. Second, all attempts and its selection on other territories was unsuccessful. Third, the creation of its synthetic analogs was unsuccessful. Fourth, Ibogaine doesn't form addiction. Respect, yes. Disgust, something. Addiction, never. In medical practice, using of Ibogaine is often associated with the concept of the most active methods for treating any opiate addiction. But as practice show, this technique is extremely effective. Narcology will help the patient to cleanse himself of the drugs, alcohol, and come to a consciousness decision to leave the addiction in the past and not return to them in the future. Psychiatry effectively and in a short time will provide healing from a deep depressive state, help get rid of phobias and internal fears in the neurotic spectrum. Neurology, restoration of the neurotransmitters balance in the treatment of severe chronic neurodegenerative disease, Parkinson disease, and so on. Psychotherapeutic practice, a complete deep reboot of consciousness and some consciousness cleaning the mind, changes attitudes to life, gives a second wind for self-realization, the best way to treat post-traumatic stress disorders. Psychedelic practice will give a person that rare opportunity to find out the truth about himself, to figure out his internal problem. Will allow him to consciously look at the mistake of his own life, thereby rethinking it. The effect of ibogaine on body cells freshens the body, restores the biochemical balance, normalizes the neurophysiological process of the brain, and replacing energy researches. All of above brings ibogaine therapy to a new level of application in multidisciplinary practice as a unique alternative to other methods, and generally accepted, not always effective, types of traditional treatment. All of you have repeatedly heard about deaths due to the using of iboga, which was one of the facts in its prohibition. Ibogaine doesn't forgive mistakes and negligence. Its use something can cause more harm than good, leading to irreversible disturbances and even death. Contraindication for use, selection criterion, and procedures. Compliance with the selection criteria and exclusion, a detailed medical history, assessment of the general conditional, physical examination, examination of organs and system, assessment of the mental state, testing for psychoactive substance, alcohol, narcotic, and so on. Apply exclusively to a clean body. Complete detoxification of the body from psychoactive substance, medication, drugs, alcohol, etc. Complex abstinence from psychoactive substance at least 7-10 days before ibogaine session. Individual selection of the type and dose of the substance using. Individually sample for each patient, taking into account the percent pure alkaloid content and at milligram per kilogram body weight. Using ibogaine is possible only after complete stabilization of body function. In contraindication are available, refuse the patient in the procedure. Thereby, you save his life and your medical reputation. Unfair services and provides. Don't forget, the effect of the produce directly depends on what substance it used during ibogaine session. Clinic use ibogaine alkaloid are not substances similar to the psycho that affects the psychedelic group. In practice, ibogaine is used in the form of dry bark of the root of iboga alkaloids, total alkaloids, purified common alkaloids, and highly purified alkaloid. Remember, ibogaine is used exclusively in the form of a powder, purified extract of ground bark individually selected according to the patient's weight, for easy of use places in capsules. Pure alkaloid for 8 capsules for procedure. Ground bark of 1 capsule for 400 milligram per kilogram of the body weight for a session. Ibogaine cannot be in the form of tea, liquid solution, solid tablets, solution for intravenous or intramuscular using. About Ukraine legislation application. Today, Ukraine can be considered as a unique state along with Canada, Brazil, and Netherlands, where the level of medical care is growing rapidly. Innovation methods and technologies are applied. Ibogaine and medication basis on it are not included in this list of substances prohibited or restricted for using and study in Ukraine. Of course, we cannot talk about all the institutions that use these methods in their practice in Ukraine, but we can share information about our clinic. This is our clinic. We are not operate only as a Ibogaine clinic. Medicamente, it's a modern medical center of modern addictology. We use a comprehensive approach of trying patient with various types of chemical and not chemical addiction, mental and behavior disorders, rehabilitation and psychological support, along with other unique techniques. We intensively use Ibogaine therapy. We have the clinic is full provided with the entire list of modern medical equipment for routine treatment and emergency care in an intensive care unit. There is always a complete list of certified medications used to detoxify the body, relieve acute life-threatening, conditional restore, and stabilized of impaired body function. The clinic employs specialized in the following areas: anesthesiology, emergency medicine, psychiatry, narcologist, psychotherapist, radiology, general medicine, and psychology. The center is licensed by the Ministry Health of Ukraine. This is the picture describe our center. Ibogaine therapy session and at the clinic medicamente. Client's accommodation with 30 basic examination by a clinic specialized related specialist, addictional researches, consultation with a psychologist. In our clinic, a long session of Ibogaine is performed with Ibogaine hydrochloride. The dosage is calculated individually according to the client's body. We use exclusively Ibogaine hydrochloride or PTA hydrochloride. Each batch of the substance, its completely spectral analysis with the extract percentage of pure Ibogaine and impurities is attached. This allows us accurately calculate the dose for weight individually for each person.
Sorry, can I interrupt? We've got 5 minutes left. I wonder if we could just go to some Q&A? Is that okay? Do you want to just finish off in a minute and then we can have 5 minutes of questions?
Can you repeat your question?
Can you finish now in 1 minute and then we can maybe ask you questions?
Okay, I very fast finished and you will ask me question, okay? In our clinic, Ibogaine therapy is used for mental and behavior disorders due to opiates using mental and behavior disorders due to alcohol consumption, mental and behavior disorders due psychostimulants, mental and behavior disorders to cannabinoid using non-chemical types of addiction, post-traumatic stress disorders, depressive episodes and panic attacks in the absence of psychopathological symptoms for spiritual growth.
Fantastic.
Why should Iboga not be used on the intoxifier body? Violation of intracardial conduction, impaired liver metabolism, the process of excretive.
3-4 minutes left, and then we have to go to the next speaker.
Okay.
Few questions.
Okay.
So I'll just ask a couple, and then I'm sure other people will have questions. So, just can you clarify, is your clinic open in Ukraine now, or is it not working?
It's a pity, but now our clinic is closed because foreign patient cannot come, and for Ukraine patient, it's impossible to now get treatment in our clinic because it's so expensive. And it's not safety, it's dangerous because we have bombed in Kiev sometimes, but it can be.
Sorry, you're going through this experience. What is the government attitude? You were saying earlier that Ibogaine is not on the prohibited list. What is the government attitude towards things like Ibogaine treatment? Are they aware, or are they completely not aware? Or maybe you can just speak to that. Did you understand?
I don't hear well. It's a pity.
Maybe someone can text the question.
It's better now. Yes, thank you.
What is the government attitude towards Ibogaine? Do they have knowledge, or they do not know what you're doing?
We have knowledge, we have a lot of experience, and we do Ibogaine to kill the only for psychological dependence, to kill the desire, craving syndrome of patient with.
The question is whether the government is aware of what you're doing, approves of what you're doing, or
government in Ukraine. Ibogaine we can use.
Again?
We are medical center with all the licenses and protocol for the Ibogaine using, and in Ukraine it can be. Now we stay in Czech Republic and we will work for opening here clinic like in Kiev. But first of all, we should do approbation, medical approbation, because we want only work with doctors' legal documents.
Okay, does anybody here physically have a question?
Yes.
Dana, you've asked too many questions, you're not allowed. Anybody else?
Are they allowed to give Ibogaine in Czech Republic?
Okay, that's a good question.
Repeat, please. I don't hear good.
In Czech Republic.
In Czech Republic, yes.
Okay. Okay. Is there any questions from the Zoom?
For the cost.
I have a question.
Mhm.
So what is the, how many patients have you treated with Ibogaine before your clinic closed?
When during week we have during week we have 5-6 patients during week
And
before 24th of February.
I see. And then what is the, do you know how many of them, if they come for addiction, do they, after they do the Ibogaine, do they stay, do they go back to using, or do they stay off of?
The patient who
The
want
success rate, yeah.
to be clean, they want to get a result for a long time. We have some patients who want to don't use drugs some period. We have very good result, 1 year, 2 years, some patient half year don't use drugs. But as our practice show, the shortest period don't using drugs, it's half year. But we recommend for all the patients, if they have some thoughts about drugs of using repeatedly, to do Ibogaine therapy, and it's the same works, but no before 6 months. After 6 months of previous Ibogaine therapy.
I see. Thank you.
All right, thank you very much, Sergey and Sergey's friend. Thank you.
I think.
Thank you too.
We unfortunately have to keep